Great. Once again, good morning, good afternoon, good evening, wherever you're joining from. Once again, we welcome you to the third episode of our webinar on decolonizing health in Africa. Decolonizing health in Africa is an initiative of Innovations for Development, the Kampala Initiative, and the People's Health Movement. Innovations for Development is a Ugandan NGO, civil society organization, working to disrupt development as it is. We work at the intersection of development and innovation, and we think that development needs to be disrupted. The new, old systems of development as it has been, are not working. So we contribute to ensure that we channel new energies, new understanding and appreciation of what development should look like. Development that works for the people, solves their problems, and addresses the critical needs, especially for those who are the most marginalized. The Kampala Initiative is a collective of civil society organizations and individuals and activists who believe that change has to happen. It started in 2019 as an initiative of Medicus Monde International and PHM Global. And the first engagements happened in Kampala in 2019. And a collection of civil society organizations came together to chart a way forward on strategizing on how to make joint actions, sharing and strategizing and making change in the space of development. I'll drop in a little bit of detail about the Kampala Initiative, and I'll urge you to join as a platform of people who are working, networking to make sure that development is inclusive, is equitable, and it serves those that need it most. There are a couple of groups within the initiative, which includes Tracking the Change Initiative, the Watching the Gap, and the Challenging PPP. It organizes a lot of activities, and part of it are the webinars, including this one. The People's Health Movement is still a network of activists across the world that believe that health must be for all. We work as activists to challenge the old systems that deliver health in our world to make sure that every person is served. We will drop in links to the website of the People's Health Movement, and we would really be glad to join the country circle. This webinar is organized by the People's Health Movement Uganda. We would at a later time have the secretariat head come and say hello or something, or have a communication. And we will also have coordinators of the Kampala Initiative later coming in to share what they're up to and what is happening within the network. Going forward, I would like to welcome you to this webinar. This is the third webinar in a series of webinars that have been happening on decolonizing health in Africa. Decolonizing Health in Africa, as a series of webinars, came as a result of a study that was done by Innovations for Development to try to articulate how colonized was health in Uganda. We took that study to understand the aspects of coloniality within the space of Uganda. And to further this, we had to engage our partners, as you know, the Kampala Initiative, the collective where we belong, and People's Health Movement where we belong, to try to understand and appreciate how can we share this information, how can we network. The Ugandan context might be similar or different, but how as a global community, as an African community, can we tap into our resources and understanding to articulate this issue better, but also to find appropriate ways on how we can engage. Engaging with the goal of decolonizing health in Africa. The COVID pandemic, as you all know, has unpacked and revealed so much that we cannot leave to waste. It's an opportunity that we can take advantage of and create a bit more understanding and in-depth articulation of issues, but most importantly, for the world to know that Africa is at the fringes of marginalization, especially if you look at access to vaccines. Africa is at the fringes of marginalization when you look at trade and all other things. So this cannot be left unchecked. So as Africans, as activists in this part of the world, we thought we should organize a series of webinars. The first two webinars, one focused on aid and financing for health and expressions of coloniality. It was a wonderful discussion. Then we held another one, which looked at the human resources for health and how coloniality manifests and what we can do. This third webinar is focusing on research. You know, research is a core aspect, especially as we're dealing with the pandemic, where so much has happened to the world and so much innovations out of research have been put forward, but they are not accessible to other parts of the world, especially the vaccines that you all know that have turned into a profiteering business at the expense of so many. So we thought that we would pull together a team of people who would help us articulate some of these colonialities, but most importantly also unpack the intricacies of those colonialities and how we can forge forward. So that is the goal of this sharing. Later, as the facilitator will guide us, we'll have a deeper conversation on how do we move forward. After having conversations and sharing, how do we move forward? What is it that we can do? Would really love to hear from each and every one of you who has joined us today, mostly discussing beyond the webinars, beyond the conversations that have happened all across the board. What are the actions that we can do? We hope that your suggestions and ideas will form sort of like a plan of action which we will take forward and share with other stakeholders, and that will infuse into the conversations that are happening on how to take the decolonial agenda forward, especially in Africa. With that preamble and introduction, I want to firstly thank all of you who have joined today. The number is great and most of you are trying to join already. And I also want to thank the organizing team, Ravi, Frank, Jovaya, Dennis, Clara, and everyone who has participated in organizing. We really fully appreciate you and the support you've given us. We really want to thank our partners, the People's Health Movement, Uganda, the Kampala Initiative, and Open Society Foundation. With that done, I want to hand over to Clara, who will take over the facilitation and the introduction of the panels, and we shall start. Over to you, Clara. Thank you so much for joining. God bless the conversation.
Thank you, Danny, and thank you. I'm not sure if you can all see me and hear me. I hope so, but yes, I think you can see me and hear me. Okay, so thank you, Danny, and a warm welcome to everyone. Thanks for joining us. I'm really looking forward to the conversation, the discussions we're going to have today, and I hope everyone else is having the same kind of feeling. We often talk about decolonization, we often talk about it in all the different domains in development, but what we don't do is we don't talk so much about the practical applications of it, or we don't also focus it on specific areas. this for me is particularly interesting, that we will be talking about the decolonization in the context of health, and specifically in the context of health research in Africa. And I'm really pleased that we'll be hearing from 3 wonderful presenters who will be sharing their experiences and their work and their perspectives on this subject. So just to give you a quick outline of the session, we will start with each presenter talking for about 10 minutes, and then we will have 5 minutes of Q&A where you can ask your questions and the presenters will respond directly. We'll have one presentation after the other. As I said, each presentation followed by Q&A, and then to the next, and then to the next. And then after the 3 presentations and the 3 short periods of Q&A, we will open the floor for broader discussion and a more in-depth Q&A that maybe extends a little bit beyond the specific areas that the presenters have talked about. So I am really looking forward to, as I said, a robust discussion and a good exchange of ideas, experiences, and perspectives. But before we move on, I would like to introduce the 3 presenters. First, we have Jovia Gonza, who is a project officer at Innovations for Development, and she is an environmental health professional with experience in research and working with communities to promote health. So Jovia will be talking to us about expressions of coloniality in health research and the implications on health systems and epidemic control in Uganda. Secondly, we will have Dr. David Musuke, who is a lecturer at Makerere University of the School of Public Health at Makerere University in Uganda. He's involved in teaching and research and community service. He's a co-chair of the Community Health Workers thematic group of Health Systems Global. He's a visiting fellow at Nottingham Trent University in the UK, and he has a number of very broad research areas, including on environmental health, on community health workers, as we've said, communicable and non-communicable diseases, etc. He will be talking to us today about the role of academia in decolonizing health research in Africa, and specifically focusing on Makerere University. The good thing about having someone with such a diverse range of broad kind of perspective and range of research interests is he can pull in his experiences from all those areas. And of course, as I said, with Jovia as well, we look forward to hearing Dr. Musuke. And then finally, we have Abel Wilson Walekwa, who is a public health specialist and a PhD student at Makerere University. He has a master's degree from Mbarara University of Science and Technology in Uganda, a postgraduate training in health service management, and has a background in environmental science from also the University of Makerere. He will be talking to us about taking a slightly different tack and talking to us about Africa's dependency on Western health research innovations and why we are where we are, and specifically focusing on the role of governments in centering research in the context of future and present and future pandemics. I think this is a very, very, very salient and relevant discussion to be having, specifically in the context that we are in now and in preparation for future pandemics, which will surely come, future emergencies more broadly. So with that, I'm going to hand over to our first speaker, Jovia. I hope you're ready, and I will open the floor for you to start. I look forward to the discussion later, as I said. Thank you.
Thank you, Clara. Hello, everyone. I'm Jovia Gonza. I'm going to be presenting a research paper done by I4Dev on understanding the legacies of colonialism in health research and their implications on health in Uganda. A paper which was prompted by the imbalances that especially marginalized communities or groups in low and middle income countries face when conducting research or when having research collaborations between the developing countries and developed countries. So some of our objectives for conducting this paper were to investigate the Western colonial influences on health research and their implications on health in Uganda, and to identify and suggest strategies to decolonize health research in Uganda. Our results got from both documentary view and key informant interviews, and I'm going to be presenting some of the colonial influences and internal weaknesses that Uganda faces when conducting her health research. So among the colonial influences, we have donor-driven research. And as you can see from the slide, I have a pie chart showing how much the Uganda government and international donors offer to fund research in Uganda. As you can see, the Uganda government and local stakeholders have very minimal involvement in health research, and most of the funding is done by external funders or international donors, who are usually the USA, the UK, Japan, and many other developed countries, sorry. As such, because the funding is usually done by international donors, they also influence how the research agenda is set. As you can see on the other side of the slide, there is a figure showing the stakeholders in research agenda setting. Some are in blue, some are in red. The ones in blue are the ones that are not actually affected by the problem. For example, the public funding bodies and philanthropic organizations, and the ones in red are informal caregivers, payers, employers, which I would call the local community. So you find that because the funder is interested in a certain topic or in a certain research area, it will drive the local researchers to go after researching in that area, because then that is the only way they can attract funding from the developed countries. It's the only way they can attract funding from the funder. And also research agenda setting is influenced by the perception of threat of the funder or of developed countries. So you find that diseases which are a threat to developed countries, for example, diseases that are easily spread or that easily cut across regions, are easily funded or make it to the research agenda, other than diseases that do not easily spread or that only affect small communities. And this is where the neglected tropical diseases such as sleeping sickness come in. You find that such diseases that are actually affecting local communities or poor and marginalized communities in Uganda are rarely funded, compared to diseases like HIV, diseases like malaria that easily spread across borders. Another influence of the research agenda is the return of profit, if I should say. You find that it is easier for funders to fund an area where they can easily make profit, other than an area where very little profit is made. Again, I'll use the example of sleeping sickness. It's harder to fund sleeping sickness or research around sleeping sickness because it affects poor communities who probably cannot afford drugs that are made by these big pharmaceutical companies. Therefore, they cannot bring back profit to the funder. Going forward, there's a domination of the Western world. There's domination of the Western world in publication and authorship. You find that the biases and prejudices towards African researchers or towards local researchers determine whether their research work will be published or not, or whether their knowledge will be shared with the world and also with local communities. So local researchers are left with a choice of collaborating with foreign researchers, a choice of collaborating with international researchers, whereby sometimes, or most of the times, the foreign researchers take up key authorship positions, such as the position of first and last author, which are driven by credibility, which are driven by desire for credit and recognition, leaving the local researchers in the middle of the author list. You also find that most of the research work published on Africa is dominated by non-African authors. Take an example of research that was done around COVID. Majority of the papers produced on Africa or published on Africa were dominated by non-African authors. And you find that there were very few authors on papers, there were very few African authors on papers from the developed world, which goes to show how much Africans or African knowledge is undervalued or it is doubted when compared to Western knowledge, which is used as a benchmark, when carrying out research. Another hindrance to publication and authorship for local researchers are the high article processing charges, which are charges that are required, which we are required to pay to publish our work in international journals. And because we want the recognition, we really struggle, I would say, to come up with to pay the charges and have our work published. But you find that when the charges are high, it hinders publishing in open access journals, which would easily be accessible to local readership. Or when that, you can, I think, default that, no, I wouldn't say default. There's a choice of paying less to publish in a closed access journal, but then that would mean that there is less recognition for you and your work will not really be used in your local community, will not be viewed by the local readership, because the people from the marginalized communities cannot afford to pay to access the work that they need to transform their communities. Also, high article processing charges leave local researchers, especially the junior researchers, vulnerable to publishing their work in predatory journals, which brings their work under judgment, if I should say. Another colonial influence in Uganda's health research is the epistemic superiority of the global north. Under this, you find that Africans or local researchers contribute a very small percentage to the global wealth of knowledge because their work is undervalued or because they may not have the qualifications such as, education from an affiliation to a Western organization or Western university. So their work may not be easily taken up as that of someone that has an affiliation to a Western organization or as that of a foreign researcher. So you find that the worth of research is determined by peer reviewers, is determined by journal editors or citation indices, most of which depend on international organizations, depend on the developed world. Therefore, you find that African knowledge or local knowledge is rarely published, thereby silencing the voices of local researchers and undermining the knowledge that they would provide to contribute to solving the health problems. We also have the domination of Western languages in research, especially the English language, whereby success is related to being able to publish your research paper in English. Therefore, if you have research work that has been carried out in a local language, which I might add would benefit the local community more than the English or any other international language, you must produce your work depending on the, I should say, qualifications of a certain journal. So if a journal wants your work in English, it means that you have to alter the message to fit the audience, and you also have to alter the language to fit that which is required by the journal. This means that the experiences and the knowledge that this research would provide or pass on to other generations and to local communities to be used in solving health challenges will be lost along the way, because most of the local communities where we conduct our research are either illiterate or cannot really understand the scientific terms that we provide in our research papers in English. We also have the expropriation of African research, which is usually manifested in international research collaborations. Whereas these collaborations benefit local communities or benefit local researchers in terms of providing funding and in terms of providing resources that are required to conduct the research, they sometimes show some manipulations. For example, when foreign researchers come to a country like Uganda and use the local communities and local researchers to obtain data and obtain raw materials, and then fly them out to the developed countries for analysis and publish their work without any further input from local researchers or without acknowledging them. Sometimes this goes as far as products being made from the data that was collected from local communities, and then those products being sold back to the local communities at a higher price, yet the research data, the raw data, was provided at no cost. Apart from those colonial influences, Uganda has her own internal weaknesses which affect the way research is conducted or which affect our output of research. As I mentioned, some of those are lack of resources, which would lead to the funding, which shows the reason as to why most of the funding for Uganda's health research comes from external donors. And also there is lack of willingness to invest in research infrastructure to support the research. Then there is a tendency for policymakers to undervalue research. And I would partly attribute this to the fact that the policymakers are not involved right from the start in setting of the research agenda. They are not involved in, they're sometimes not involved when the research is disseminated. And sometimes the language that is used, the scientific terms that are used, are not easily understandable to the policymakers. Therefore, they end up undervaluing research or not giving it much attention as something that can be used to solve health problems. Another is insufficient training of researchers or shortage of mentorship, adequate mentorship, especially for junior researchers. We go to universities and study research methods and study so many things to do with research, but mainly with an aim of passing this as a requirement to obtaining your degree or obtaining your master's degree. There are very few junior researchers that go further ahead. There are very few junior researchers that are further mentored by people that have already gone through the research environment, if I should say. Then there is inadequate capacity to review and monitor approved studies, and the lack of adequate national ethics guidelines and accreditation, which is why we have expropriation of research to Western countries. Among the implications of the colonial influences and internal weaknesses that Uganda is facing in her health research is the dependence on the West for research solutions, which rarely adequately solve the health challenges, but only fill the information gaps. Like I mentioned, we have very many diseases, like the neglected tropical diseases, that are plaguing marginalized communities, but we have so many solutions to diseases such as HIV. So many medicines have been made, if I should say, but there are others that are killing people out there that are not really making it on the priority list of research agendas. And then we have the mistrust between researchers and research subjects due to the exploitation of research of ethical standards, the silencing of voices of local researchers because their work is undervalued and because they have to collaborate with international researchers only to be sidelined. And then we have the vulnerability of local researchers to publish their work in predatory journals. After coming up with the results and the implications, we thought that we'd make a few recommendations to different groups of people, if I should say. Among the recommendations was to increase funding, was for the government of Uganda to increase funding for health research and focus on health priorities, especially for marginalized groups, to develop a streamlined research agenda that should be followed by both local and international researchers, and to hold these researchers accountable to the communities and to the government for the research they have done, which would be ensuring that this research is actually positively impacting communities. And to the researchers, we think engagement of policymakers right from setting the research agenda is important, and the simplifying of some scientific terms, especially during dissemination of the work, and also to disseminate research to the target communities from where it was conducted, so that solutions, sustainable solutions can be made from this research that can actually help the communities. To funding agencies, we think it is important to involve local stakeholders, and that local researchers should always take up the role of setting the research agenda, so that the problems that are actually affecting communities can be researched and solutions to them can be made such that they can help the communities. And then to training institutions, there is need to increase capacity building for young researchers and to provide funding for the institutions such that they can become centers of intellectual and groundbreaking research. That is all I had. Thank you for your time.
Sorry, I forgot to mute. It's 2 years post-pandemic and we're still making the same mistakes. Thank you very much for your presentation. I think I can open the floor for questions. I found it really, really interesting personally as somebody who works on the other side in a way, who works in an institute in the north. It's really interesting for me to hear some of the findings you had and some of the recommendations. But now I would like to open up the floor to anyone who has questions. We have about 5 minutes. Okay, so I have a question here already from Moga, I think. It says, how do you persuade governments to fund research as a national priority? For instance, if you use COVID as an opportunity.
Thank you, Clara. How to persuade the government? I think first of all, one way to persuade the government would be to show them how much communities are affected by the problem that you probably want to research. In this case, COVID. We need to show the government how much communities are affected by COVID. Leave alone the health bit of it alone, but we have the economic side of it. So I think really persuasion of the government and the involvement of these local communities, and not just the stakeholders, what should I call it, stakeholders high up in the ladder, if I should say. I think involvement of local communities to persuade the governments would be a very important step. Not easy, but I think it would be one way to persuade, and also to show them how much the problem actually affects communities.
Okay, thank you very much. We have a second question here, and I think after this we'll move on to the next presentation in the interest of time. But the next question is from George, who was asking if you could speak to the extent to which ongoing research or partnership in research aligns with Ugandan government research agenda, and then they go on to give an example. So how does ongoing research or partnerships with research, with the research agenda? How does this align with the Ugandan government's research agenda? They've given an example here on the National Child Focus Policy Research. Can you speak a bit about that, please?
Please repeat the question.
The question was, how does research agendas, I guess in this, they probably meant or mean external actors' research agendas. How does it align with the research agenda of the Ugandan government?
Oh, all right, thank you. I would say some of the research done in Uganda really aligns with the problems that we are facing, if I should say. For example, research under HIV, research under malaria, but not all of it. Like I said, you realize we have many other problems except for HIV and malaria, but you find that the research does not actually, if I should say, touch those other problems. It has left them out. So I would say the collaborations only partially solve the problems that Uganda has, not entirely.
Okay, so the answer is partially, but not completely aligned.
Yes.
If I get you right. Okay.
Yes.
Thank you very much. If it's okay with everyone, I think we can move on. We have a few more questions, but I'm noting them down, and we can have that as part of the broader discussion in the larger Q&A later. So I would like to thank you very much, Ovia, for the presentation. As I said, it was very interesting for me personally, and I think from reading the comments, also for the other colleagues on the webinar. And with that, I would like to invite David, if you're ready, to please take the floor. Thank you.
Thank you very much, Clara, for the introduction, and thank you to Innovations for Development for organizing this series of webinars, but also for inviting me to share experiences on the subject of the movement on decolonizing global health. And I hope that our experiences that I'll share will be informative and useful to many of the people that are on the call this particular afternoon or evening, depending on where you are. So just to get us started, as many of you would know, in the recent past, there's been a lot of debate and a lot of discussion on the subject of interest today. And it is quite evident that indeed a lot of interest has been picked regarding decolonizing global health research. And just as an example, in 2020 alone, there were over 50 academic articles on this subject. And in addition to that, several conferences and meetings had this subject for debate, but also a lot of public figures and global health research leaders made very strong statements on the need for us to ensure that global health research is equitable and that there's no exploitation among the different players and partners that are involved in this particular research context. And I also want to add that, as you can see, a lot of the literature has been in form of peer-reviewed articles, in form of blogs, in form of commentaries, which really shows that this is a subject that is very topical. And I'm really pleased that Innovations for Development and colleagues have really spearheaded this particular initiative, which I believe is critical, especially for us researchers, but also other players across the board. And one thing that has also come up in the recent past is that although a lot of evidence and discussions are going on regarding decolonizing global health, a lot of this is being driven by the global north. And I think there's need for us researchers in Africa and of course other stakeholders to really take the bull by the horns and also actively engage in these discussions. And I'm glad that we are leading such initiatives, which I believe will make a contribution to this topic now and moving forward. I wish to just share with you now some case studies regarding how the whole research in Africa is experiencing a number of scenarios of inequities and unfairness and injustice, but also along the way try and give some examples regarding how we researchers can try and bridge the gap and ensure that research is beneficial to all partners involved with less inequities, as I mentioned earlier. One of the things that is very clear, and Jovia mentioned this earlier, one of the key challenges we've witnessed as researchers at Makerere University, and many of you would know that Makerere is one of the leaders of research in Uganda, and therefore, whichever discipline you talk about, research at Makerere is quite strong. But we have witnessed as researchers that sometimes we are driven to do research in subjects or fields that have not primarily been informed by we stakeholders from the global south. And sometimes funding agencies have interventions laid out that are not necessarily fully in the interest of the southern partners, but many times in their own interest. And that has, in some instances, driven researchers to go into fields that are not necessarily of priority, but also meaning that in our local context, we are not necessarily addressing the most at need research topics and interventions. And I believe one clear way of having this addressed is by having global South partners take part in those global discussions in terms of setting the research priorities and agenda, so that indeed whichever research topics and areas are put out, they are indeed addressing a need in our local context. One particular funder I'm aware of in the recent past, before releasing a major funding call, and this is in the UK, managed to do a scoping visit in all the countries of focus, whereby they came, including to Uganda, met the Ministry of Health stakeholders and researchers and other partners to really understand what are the main priorities in Uganda. And after doing that scoping visit in the country, they also did the same to other countries, and then came up with a very robust funding call that was clearly addressing the needs of the respective countries. That is one way in which this particular challenge could be addressed. The other point to note is that, of course, as you'd expect us researchers to do research, we are involved in writing several grant applications for funding, which of course have to be evaluated. And in some instances, we have found out that some of the funding agencies have their expert panels reviewing our applications that may not necessarily be knowledgeable on the local context and the local situation. And sometimes funding proposals or applications for funding through what we write is sometimes rejected, not because we have bad ideas, but because the context in which we write and the context in which our research domain lies is not necessarily understood and appreciated by some of the funding bodies. So I believe that if some of the funding agencies, as some of them already do, have some of the Global South experts as part of the evaluation panels, it would really help that our applications are judged well and the decisions are made that are indeed appropriate and not necessarily affecting African researchers simply because the reviewers are not necessarily appreciative of the context or are aware of the context and the complexities in which we work. The resources is another thing to talk about, and many of you know that resources are critical for us to do research at Makerere University and beyond. But we found in some partnerships and global networks that we read about and sometimes see with our colleagues, whereby there's not an equitable distribution of resources between global North and global South partners. And you find that research may be conducted in Africa as part of the collaboration, but most of the resources are actually in the high-income country. And resources could include, staff. It could include human resource, offices and so on. But most importantly, even the funds for actual research. And sometimes you find partnerships whereby over 60% of the budget is controlled by the high income country and very little in the developing country, yet the research is being done in Africa, which I think is unfair. So there should be some level of equity in resource distribution so that the country where most of the work is being done primarily receives the majority of the funding to be able to support the research activities and of course other initiatives that are in line with what is being proposed to do. Research leadership is also critical. And as I said, in many research activities nowadays, these are carried out as a form of a partnership between a global North and global South partner. And we've seen for many years research teams whereby the leadership is predominantly by the global South partners. I'm not saying that global South partners cannot lead research in our African countries, but the point is that if they are well-trained and well-experienced and there's expertise in terms of researchers from the African countries, it would be in interest that those researchers take lead because they probably know the context better and indeed they know the complexities of doing research in our setting as opposed to any other. And I want to give an example of research we are doing currently with partners at Queen Mary University of London on COVID-19 and its effects on the health system, whereby although there is a UK lead partner and principal investigator, all the 4 participating African countries and universities have local principal investigators who take lead in the local research activities in their countries and are accountable for whatever happens in that setting. So in that case, we have some level of equitable partnership whereby although there's a high income partner, the research and the agenda in our respective countries is actually driven by us indigenous researchers. Participation in research, we've seen for many years, high income and global North partners sometimes flying in our African countries, sometimes conducting research without any involvement of the local partners, whether in the conceptualization or in the delivery or in the writing or in the, you name it. And that is really unfair. And of course, this has improved in the recent past for us researchers at Makerere, but you still find instances whereby global South partners parachute and collect data and run away. This, of course, over the years has been reduced, and we've put in place some measures in academia to reduce on this. For example, most ethical review boards in Uganda, including at Makerere, would not approve any study by a global partner if there is no local partner involved, including a principal investigator from Uganda. And in that way, this tries to control involvement of local researchers in all research, even if it involves global researchers, which I think is a good move, and it ensures that there's participation of indigenous researchers in activities in our developing countries. And then the last one is publication, and Jovia also hinted on it. We have seen for many years publications whereby there's hardly any African or indigenous researcher. And for those that have, many times these are not necessarily given priority in terms of the writing or even on the authorship list. And I think this has to change. And especially when there are researchers in the African country who have the expertise and experience and the skills to actually do the writing and take more prominent positions in publication. I'll give you one of the interesting examples. A few months ago, I received a manuscript from a journal to review, only to look at the paper critically, and there was no, and actually the research was carried out in Uganda. There was no single author on that list from Uganda, but also in the manuscript, there was no single indication of involvement of any Ugandan researcher or investigator or partner whatsoever, not in the conduct of the research, not in the ethical approvals, and nowhere. And of course, having been given a chance to review, I actually recommended rejection of that manuscript. Again, there were other reasons and shortfalls I noted, but that was one of the reasons I highlighted to the editor of the journal, and I hope that indeed they took on the recommendation. But increasingly, journals nowadays are quite open, and of course we have a number of journals that are also keen to support academics from low-income countries to publish. There's one new journal in particular, which is PLOS Global Public Health, which is very keen to bridge that gap between the global North and global South researchers. But also the issue of publication fees, which again, Jovia hinted on, the number of journals that nowadays waive publication fees or article processing charges if the first or corresponding author is from a low-income country, and BMC journals are one of those, and I've published in them several times, but also other journals such as the PLOS category of journals. If you as a low-income country author can justify that you don't have resources that would be required to pay for those charges, they can waive the charges and you're able to publish open access in that particular journal. Then lastly, I want to share with you our experiences. Some of you who know about our work at Makerere School of Public Health know that we have a 10-year-old partnership between ourselves and Nottingham Trent University. And I saw earlier my partner in crime, the Nottingham Trent University lead, Dr. Linda Gibson, a part of this particular webinar. But our partnership over the years has developed a number of principles that we have followed over the years. And for us, these are key, and they have really helped us over the 10 years or so, conduct a lot of research and implement several projects, but more importantly, do it in a mutually beneficial and equitable way without necessarily having any injustice, as we've seen in other partnerships, but also other settings. These will be the last key points I reflect on. One of the key principles we've realized is critical is mutual respect, and we've written a book chapter on some of these principles. From the start, we appreciated that indeed we need to respect each other, both as a local low-income country partner and a high-income country partner. And with this respect, we're able to sit on a table and give views and ensure that our contributions matter to all partners, which has really ensured that our work moves on smoothly and fairly. Equality is another principle we've tried to emphasize. Again, not always easy because we have our strengths, they have their strengths, but as much as possible, we ensure that we build on each other's strengths, and that indeed in whatever we do, we ensure that each partner is bringing something to the table and all of us benefit as a whole. Transparency is critical, and I think if partnerships take on this would also bridge the gap on the inequalities. So transparency in writing proposals, in implementing research, in writing manuscripts, in dissemination, in budgeting and developing budgets and reports. This has been critical, and transparency also ensures that each partner is aware of what the other one is doing, and indeed work can move on smoothly. Trust is critical, and I believe with this trust, it has helped us conduct our business quite smoothly. For example, if there's anything that has to be led by the Nottingham Trent University team, we are quite happy to let them do so, because we know whatever they will do will be in the interest of the partnership, and vice versa. If there's a stream of work we are conducting in Uganda as the lead partners on that, NTU, as we call it, would be very comfortable and happy because of that trust we have built over the several years of our work. The next is reciprocity, whereby we ensure that in whatever we do, there's benefit for both the Uganda and the UK partner. And we've seen partnerships whereby, say, UK or US or Canada, the partners are really involving the low-income country partner just for the sake of having somebody on board and for them to meet their goals and objectives and interests. But for us, we have ensured that in all that we do, there's something in it for us, the Ugandan partners, and something for the UK partners. And this has really kept our partnership very strong. And indeed, it is growing stronger by the day. And lastly is cultural appropriateness. This is critical. And as I hinted earlier, sometimes in our African setting, it is we, the African investigators, that know best what is happening on the ground and what indeed has to be done. And our partners in the UK are very open to listening to us and to working with us in that context. But also for activities we carry out in the UK, including collaborative research, we know that the UK partners are indeed the specialists and those who know what's happening in that context. and therefore we let them drive the agenda in that context. And indeed, that has worked well for us in the past. So thank you very much for listening to me. Just to end by saying that this topic is very important, and we know some of the shortfalls and what has to be done. I think it's in our interest as African researchers to put our hands up and put our feet on the ground to make a case, but also take the lead and initiative to have our voices be heard and play an active role to ensure that we take a lead and participate in this discussion on this colonizing global health. Thank you very much, and I'm happy to take on any questions. Over to you, Clara.
Thank you very much, David. And I see some questions already, but if it's okay, maybe we could move on to the next presenter. The reason is the questions are also things that the other colleagues can talk about. And since we're running out of time a bit, if it's okay with you, I'll pass over the floor to Abel, and then we can, all four of us, well, all three of you, kind of lead the discussion. But thank you very much for the presentation, and I look forward to the discussion after our next presentation by Abel. Over to you, Abel.
So thank you so much, Clara, and for the opportunity. In the future, you make sure that I speak before my mentor speaks. Clara, for your information and the team, I am who I am today because Dr. David Musoke existed, so he has mentored me for the last 10 years. So part of the views I will give, part of the ideas I've learned from him over time. So thank you so much for organizing this webinar. It's an important one, and I was excited with the topic that you gave me to speak about, and I want to say that it is a big topic. I needed a full hour for me to dissect this into the nitty-gritties, but with the 10 minutes given to me, I will be able to share the tip of the iceberg, and I will request that the conversation will continue. Jovia, I want to dedicate this second slide to you. Whatever you wrote, whatever you mentioned, I am in agreement, and we are in agreement. And when I say we, I'm referring to the Presidential Scientific Initiative on Epidemics that is housed at Office of the President. The conversation, the ideas, the findings that you got in your research is a part of the issues that we are addressing on as a government entity or the government of Uganda. And very soon it will be under Science, Technology and Innovation, which was formerly MOSTI, Ministry of Science, Technology and Innovation. Now we have done a lot of research in the past 1.5 years. And so I'm going to be sharing with you part of the information that we have put together. Now this slide you see is that we have done a synthesis of the leading companies that are harvesting dollars in research and development in the global market. And I want to inform you that the first 50 companies or entities or organizations, none of them is from Africa. I just cited the top 4 with Pfizer. They are taking the lead from the US and others. But I'm telling you, the first 50, none of them is from Africa. And that's why this conversation that we are having today, ideally, was supposed to have been held 50 years ago. Nevertheless, we are on, and I hope we should be able to get issues out of it. Now, I am going to be responding to the questions that I was asked. Question number 1 was, why are we where we are today? And then number 2 is, what is the government's role for R&D in Ugandan context? But before I speak about those questions, I'm going to share with you the analysis of the research models that we have done. We have taken time to analyze what has been going on in Ugandan research. And so I'm going to share with you some of the findings. Now, we have called them models for conducting research in Uganda. These have been going on in government entities. We focused so much in the government entities because we are a government entity, but we also felt we should first profile what is available before we can bring in a model which can support research in Uganda. Now, these are wide. I just want to share with you briefly. The first model we describe here is called a solo researcher model. Now, in this model, we get one person who gets his idea and he or she focuses on this idea, and will work very hard to see that this idea goes into commercialization, into marketing. So they will move with the idea from the beginning until the end, without wanting another person to come. And this is in line with what Jovia said, people work in silos. Now, that solo researcher model, it takes a lot of time to break even. We have two researchers that have been doing on some product for the last 16 years. The government has been funding them, and they haven't yet broken even. And so the Ministry of Finance is tired of funding research because they think that they are putting money when they are not where they are not going to harvest soon. Now, the second model we describe is the public good model. Now, this model has been applied mostly by the National Agricultural Research Organization in NARO in Uganda. They do a lot of work, and I'm referring to some of their entities like in Namulonge, in Nachisesa, and other places. They develop prototypes, and after developing those prototypes, they donate them to their partners who are always from the global north. I want to inform you. So they give them, they just give freely. So those people go and commercialize, and then Uganda imports. So that model, we call it the public good model. The third model I want to talk about is the sector model. Now, this sector model is where different ministries say, no, this is for me, I want to do research in this area. This is the Minister of Health, this is the Minister of Education, this is the Minister of Science and Technology. Please don't enter here. This is the ministry, this is this ministry, this is the Makerere University issue, this is the Chambogo University issue. Please don't step here. Now, that one is called a sector model. Now, in that model, there's a lot of infighting, and people protect their idea, and they lose out of another contribution from another person. Now, the last one is the slave model. Now, we put the word slaves in quotes. Now, the slave model, this is where a researcher will have a collaborator, and I want to use an example of the global north, and they will be doing a lot of work. They will be doing a lot of collaboration. But when the data is being collected, it is the engine, the receiving engine for this data is in the global north. The analysis is done in the global north, and the scientists in Uganda, what they benefit is publication. Now, what that data does, even after this research has been done, either 10 years, 20 years later, this researcher here in Uganda does not mind. However, this researcher benefits with some operational costs in the day-to-day running of the project that's going on. And so they keep writing for these grants and keep collaborating, and they keep life going. These models are broad. I've just given you a small snapshot, and in the next conversation in future, I'll be able to give you details on each of those models. Now, the government of Uganda is proposing a new model, which we are calling the preside model. Now, the preside model focuses on us being able to invest research in 1 or 2 or 3 priorities, support them to move from the idea level to prototype to commercialization, and then at commercialization level, part of the money, part of the profits goes, of course, the innovator, the owner of the idea takes the highest amount of money, but the government takes 15%. Now, 10% of that money goes to what we call the Research and Science Fund. Now, we are envisioning that 5 years from now, research in Uganda should be able to be self-sustaining. It should be able to sustain itself. We are against the idea of giving 100 million shillings to this innovator, which moves his idea from idea level to prototype, and then they share a bit there. They keep it there for long, and they don't move it from the prototype level to the markets. So we want to see how we can support people from idea level to the market level. That's another very long conversation, but the dream that we are having here. Now, I want to answer the first question. Why are we where we are today? And Jofia has highlighted it as if she had seen my slides. Point number one, as a country, we did not have the research agenda. We did not have an area we say, you know what, for these years, every master's student, every PhD student in Uganda should be doing work in line with maternal child health, malaria, or water hygiene and sanitation. That was not there. And that is partly why we are where we are. Number two is that we had limited government investment for research and development in Uganda. It's a fact. I was excited to see Georgia bring out 8% as government's investment. That's very minimal, and it is true. And that's why we are where we are today. Number two, the orientation of the scientists. And please, the blame is not on the scientists. The blame is in the academic institutions, maybe, or even government of Uganda. I want to tell you that the professor at Makerere University will be promoted, will be recognized by the number of publications he or she has done, and maybe the prestigious journals he or she has sent the work to. But the focus or the question will not be on which products have you patented in the Uganda's name or in your name as professor whatsoever. So the orientation, the benefits and the recognition is more if somebody publishes than if somebody innovates and patents an idea. Now that's why we are where we are today. Kirara, I want to show you that Uganda will import 98% of whatever you see here. And there is a skewed negative attention towards Ugandan innovations. People don't value them. People don't think they are worthy competing. So that is a gap. So we should change the way of rewarding scientists. If a scientist is able to innovate a product and patent in the names of Abel Walekwa, that scientist should be honored more than somebody who has published a lot of work. Of course, publishing is very good. So the fourth point I bring here is that we didn't have a one-stop center for R&D in the country. It was not there. So a researcher in Guru University will have an idea and then they will get stuck along the way, and no one is there to pick them and help them continue. And part of this was cued by our friends who were here a bit earlier. And I'm on the topic of decolonizing research in Africa. So the next idea we bring about is that we didn't have a complete research and development value chain in the country, but also the policies that were skewed so much on evaluating the imports than exports. I want to show you that the regulations like National Drug Authority and other entities, they were so much comfortable evaluating an import of a finished pharmaceutical product than evaluating a Ugandan-made product. Now, this is a very big conversation, but also Jovia hint about it there. Now, on my right here, I share with you the research that we have done. Now, this is a global market of the pharmaceutical needs in the whole world. You realize that globally, there is very high demand for human pharmaceutical products. And so if Uganda can just come and position themselves here, they should be able to reduce importation of everything. But also I want to share with you the pharmaceutical budget the governments invest in pharmaceutical products. I'm so much skewed on pharmaceutical because it is where we've been doing a lot of work. And we are encouraging our scientists, our innovators to think deeply on how we can contribute to producing our own products here in Uganda. And we patent them using Ugandan names. So just look at the budget here that Uganda is the second largest investor in pharmaceutical products in the East African region, of course, with Kenya taking the lead. So what is the government's role? Now, I will not tell you what the government is supposed to do. I am going to tell you what the government has done so far and what we are yet to do. So first of all, we were able to come up with a value chain that we think that we should support the scientists in the country to move from the level of basic research into product development up to the point of commercialization of the idea. So the government has taken a deliberate effort in developing this. They want to support scientists. They want to fund you from the level of doing basic research up to the end. And like I told you, at the end of it all, you, the innovator, you will take 65% of the royalties and the benefits of your intellectual property. The government will take 15%, and the institution where you work from will take 20%. Now, this is the value chain mechanism, and I'm going to share these slides for people to appreciate what we are doing. Now, we also realize that whereas we, as a country, we have so many scientists, we are scattered. We don't know which expertise that we have in the country. We don't know who is good where. We don't know who is good in which area. So we have developed a Ugandan scientist networking platform that we are encouraging Ugandan scientists to register. And once they input the skills that they have, we will be able to pick them on, but also they can be able to see each other and collaborate with each other. Kirara, I want to inform you that right now, if you want to do a project in Uganda and you're looking for a microbiologist or a materials engineer, there is no one-stop center that you can find such a person. So we feel that if we had a networking platform, we will be able to support and coordinate research very well. As I get to that towards the end, the government of Uganda has put together the central support facilities for all research in the country. We have been able to put together, and we now have a lab animal house. So if you want to do any research that will involve animal research, we have one-stop center at Makerere University, College of Veterinary Medicine. We also have a biomarker research facility. So we want to biobank. We want to keep samples of what is happening now. We think they will be useful in the near future as we are planning and genotyping and everything. We are also establishing a lot of central support system whereby somebody at Gulu University, somebody at Makerere, somebody at Chambogo can able to come and use these central support systems. There is more that the government is planning to do right now. Actually, as we speak right now, we are putting together think tanks. These think tanks, they are 6 for now, and they are going to be the core for science, technology, and innovation in Uganda. And we are not only looking at the medical bit, no, we are spreading all through. So we are looking at the engineering think tank. They will be innovating. They will be thinking of ideas that can help a rural person to come out of poverty or to develop the idea they have. For example, people who are doing fabrication in Katre here on Entebbe Road, they are doing a lot of work, but no one is paying attention to what they are innovating. They are making beds, they are making knives, they are making whatsoever. So we have put together 6 think tanks, and please, you're welcome to join any of them, that will be thinking, will be innovating, will be bringing ideas that can help people get out of poverty. Now, we are planning to do a scenario planning session. This scenario planning session is going to envision where the country is likely to be 10 years from now. Once we do this scenario planning session, we are going to design the research agenda for the country. And we say, you know what? All academic institutions, all research institutions, for the next 10 years, let us put our research in this area and let us develop products that will help our people get out of poverty. And then we are also doing, we are profiling prototypes. I want to show you, Kirara, that our young scientists are very innovative, very, very innovative. There are very many scientists who have ideas that they have shelved just up there. So they came up with an idea, it reached a prototype level, either they got funding from maybe say maybe DFID, got $5,000 US, moved their idea up to prototype level, and they got stuck. And no one is paying attention to that idea. Yet that idea could transform the country. So we are profiling that, and we think that we will do a lot of work ahead of the World Science Day celebration that they are in November. So we want to see, so far what we have found out that Makerere has a lot of prototypes, and Musitema University have a lot of prototypes. So we want to identify those scientists, we want to support them through the value chain, and we see which ideas that we can fund, and which ideas we need to fund next year, which ideas we need to fund the other year. Now, as I conclude, the Presidential Scientific Initiative on Epidemics has a funding model that I want to share with you here, and this is the last slide, please. We begin with a problem, we focus our attention on the problem, and then we ask people, do you have a solution to this problem? For example, let me give an example. Currently, we are importing everything from China. Currently, as we speak, we are importing almost everything from China. Okay, let me be fair. All our roads are being made by Chinese companies. Yet we produce engineers here at Makerere University and other institutions. That's the problem. So do we have a solution? So people come up with ideas, and then from there, through the think tank, they get a viable idea. And then after getting a viable idea, the government of Uganda funds it, and then they move along with you until the end. So Kirara, as I conclude, this is a very important topic. I want to tell you that once you finish the synthesis of this discussion and the ones we've had before, we are interested in getting a report of this. And at one time, if you want audience with the Minister for Science, Technology and Innovation, please let me know. I'll create for you an audience, because what you're doing is what actually we are also doing. And I thank you so much for listening.
Thank you very much, Abel. Thank you for very, very comprehensive presentation. And also it's nice to see a different perspective. So far, it's more been from the academic side or from the private side. And it's really great to see what the government side of things are also working on. I think you made some propositions with regards to, getting a report and maybe passing that on if need be. I will leave that open to the colleagues that organized the session, so to Frank and to Danny, and I will let them get in touch with you to discuss anything about that. But thank you again for the presentation, and I will very quickly open up the floor because we don't have a lot of time. I think I can maybe say we have half an hour, maybe 25 minutes for a discussion. We have a number of questions that you could say, in fact, all the three presenters could respond to. So what I would say is ask each of the three of you, so David, Jovia, and Abel, to please turn on your cameras, and I will put the 5 questions that we have to each of you, and see if you could give your viewpoint and just to hear back your perspective. In the meantime, I'll keep an eye also on the chat box to see if we have any more questions come in. But so the first question was targeting mostly Jovia, but I guess the others can respond. I will come back to you in a minute. Siobata, I will just ask this first question first. And the first question is, someone had said that you spoke about Ugandan research being often undervalued. But what can be done then to put some value on it, to make it at the same level, in a way, as external research by external collaborators or research at the international level? Can you talk about this? I will start with Jovia because this question came up during your presentation, and then I'll open the floor for the other 2 colleagues to answer. You're on mute, Jovia.
I was asking to please repeat the question.
Okay, so the question was, you had said Ugandan research is often undervalued, I guess, on the international stage. So what do you think could be done to kind of valorize this research, to bring it to the same level and standard and kind of image as research that's been conducted at the international level?
Thank you, Clara. I think first of all, at the national level, we need to appreciate our own research. Like Abel mentioned, there are very many young or junior researchers out there that have done very impressive research work, but it has not been recognized by government or by the institutions that they are probably working for. So I think first of all, it would be good for us as a nation to recognize the work and the knowledge that is, what should I call it, innovated, if I should say, by the researchers that we have here. Also, there is need to improve, let me call it, sites for publication here in Uganda, so that research work is shared, that the research work done here is shared within the country to solve the problems that are affecting us and also to recognize these researchers. Then at the international level, I would suggest what Dr. Musoke talked about, the issue of transparency, the issue of trust, and working together to see that all the researchers involved in a collaboration receive the recognition, and also that the work, or that what they have contributed to the research work is not only seen, but also used to help a nation and the global community, if possible.
Thank you very much. Thank you. I will jump straight to Dr. Musoke because Jovia alluded to some of the things you said. So if you could continue, please.
Thank you, Clara. I reflect on 3 points in terms of having our research in Uganda looked at more seriously and valued more. The first one, I think as researchers, we need in our research initiatives to involve key stakeholders more from all levels. And this includes, of course, government and national level, policy makers and government institutions, including PRESIDE and other research bodies that are coordinating research at national level, but also involving other stakeholders at lower levels, subnational level, districts, working with NGOs, but also the community and other players at the grassroots. I think if we involve key stakeholders at all levels, that would ensure our research is well recognized and valued within the country. The second point is us researchers need to disseminate our findings more and ensure that the key audiences get to know what we do. And of course, as you know, in academia, we are sometimes biased towards peer-reviewed publications, but I think we need to go beyond that to disseminate in policy briefs, in workshops, in seminars, blogs, community engagements, and other forms of platforms, social media, so that our research is known and people can want to use it and help inform decisions. And lastly, us as researchers, not doing research for the sake of it, but doing research that is appropriate and relevant to the local context. I think once you do research that is more needed and more going to have an impact in the country, there's more reason for that research to be appreciated than one doing research that may not necessarily have a very big bearing on the health system or on any other discipline within the country. Thank you very much.
Thank you. And now I will ask Abel if you have anything to add to this comments by the 2 colleagues.
Clara, sorry, my network went off. I didn't get the question. Sorry.
Okay, that's fine. The question was what can be done to ensure that Ugandan research, which is often, as Jovia said, undervalued compared to other international or northern-based kind of research, what can be done to make sure that we increase the value of it, so at least it's equal to the other research that's done in the global north?
Yeah, thank you so much, Clara. I want to agree with what Jovia and Dr. David Musoke already hinted on, but I just want to add in one thing. I just want you to imagine if at all the research that we do for graduate students and undergraduate students had an intervention arm on it. For example, you do two objectives, say to understand the knowledge level, yes, the attitude level, and then the next objective, you want to conduct an intervention. I strongly think that intervention would move a policymaker, but also would make that community person to understand that, wow, I've benefited this because of research done by Makerere University students. I want to end it at that.
Thank you very much. We still have 3 other questions, but because they're linked, I think I will pause and ask Siabata to ask your question and then go back to the list of questions I have here. Please go ahead.
Oh, hi, Clara. I hope everyone can hear me. Mine is not necessarily a question, but a contribution. I think for those of us who were part of the Kampala initiative in 2019 will remember that one of the key issues that came up was that we need to change the narrative around health, and that and from what I'm hearing and understanding is that as part of the decolonizing of health, we need to think about and talk more about health from a non-medicalized perspective, so that not everything about health is about medicine. We end up thinking that our ministers of health are actually ministers of medicine, when there is a lot more to do with health that has very little to do with medicine. So if we are to talk in terms of primary health care, we know that we need not even talk about provisional access to medicine, because we'll have access to clean water, sanitation, food, and its production will have helped us not to even go to the point where we need curative care. So as part of the decolonizing of our health and our approaches, we need to also challenge the narrative and change the narrative. So I'm happy to be part of the discourse, but I think we also need to put more emphasis on primary healthcare. That has very little to do with medicalized healthcare. Thank you.
Thank you very much. That was a good contribution, and it actually links with my next question, which is someone had asked, we're talking about decolonization, but Africans also have our own biases, our own prejudices. So when it comes to things like gender, ethnicity, nationality, socioeconomic kind of class, we have certain biases, and if you work in research, obviously a researcher feeds their own perspectives also into the work that they're doing. So how can we deal with our own internal prejudices, and how can we deal with our own our lived experiences that guide us? And an example is what you just talked about, like seeing health purely from the medical perspective. How do we deal with our biases, but also how do we ensure that we are able to come out of the rigid kind of training we've had, some of us, in a way that fits more with a non-decolonized way of looking at things? So it's kind of 2 questions there. I hope the panelists understood the question, but I can repeat it, of course, if it's not clear. This time I will start with Abel, because you were the last person the last time.
Yeah, thank you so much, Rara. And that person asks a very important question, and I want to share with you what we are doing right now. Now, and what they've just raised is true. People are used of working in silos. People want to work alone. Makerere University wants to remain as Makerere University. Kyambogo University wants to work as Kyambogo University. The Department of Social Sciences wants to work as a Department of Social Sciences. They don't want to have somebody from the other department, not even the other technical input from the other department. So that is the main challenge that is bringing to people despising each other, but also even not believing in each other's work. Now, what we are doing here at Science, Technology, Innovation Ministry is that we are cognizant of that. So what we are doing, we are making scientists to work together. So if there's a project we are going to fund, for example, 2 billion shillings, we feel comfortable to see Gulu University on board, Busitema University on board, even if the principal investigator is from Gulu University, we feel comfortable to see a co-investigator from another research institution. Now, in so doing, they get to appreciate each other's efforts and input, and we think that we are also making it deliberate that we gender balance there. So if there's a project, we will make sure there is a female person on it, and if the PI is a female, we will make sure the co-PI or the other, if we can even have 4 co-PIs, but when there is gender balance there, or in the project team, like the coordinator or the research assistant or something, we strongly recommend to have gender issues in, but we are trying to break the silos. We don't want people to keep working together. Actually here, if a project comes in, we don't fund if it is one institution alone. We want to see that they work more than one. We think there we shall break the silos, and we should also break the issue of people underrating each other. Over.
Thank you. That was a good response. But before the other colleagues answer, I will just put a layer to it. I think one of the things you said was trying to force people to, or encourage people rather, it's more positive, to work together, to collaborate. But if in answering the questions, the other colleagues can think also beyond their own country context and how we can, within the continent, at the continental level, also work on our biases and also responding to the other questions. Over to Dr. Musiki.
Thank you, Clara. And just to add a couple of points, it's true that researchers have their own biases, and sometimes you can't get things move on as they should be. But I think in the instances where there are very clear gaps in terms of differences in particular aspects of, say, research teams, whether it's in terms of gender or ethnicity or background, I think there should be some deliberate effort undertaken by those in charge, whether it's steering committees or research groups or teams, to ensure that there's an all-inclusive approach, to ensure that the teams are not necessarily biased towards one side, but also those biases are minimized, and those deliberate efforts can be done. We've done them in some of our work. As an example, in some of our partnership work, we have ensured that for certain projects, we pull in people from different disciplines with different expertise, and this is increasingly being looked at favorably by funders when you have a multidisciplinary team. So even with my background in public health, I work with researchers from veterinary medicine, from social sciences, from microbiology, and many others. And having these disciplines actually strengthens our research teams as we apply for funding, but also other differences in terms of having senior investigators and junior researchers, having a good mix of males and females, having early career researchers a part of the teams. All those we have built in intentionally, which makes our research groups quite diverse. In terms of working in silos, one thing I want to also add is that at Makerere University over the past so many years, we have also in our training tried to incorporate working with other disciplines. When I did my degree at Makerere undergraduate many years ago, I don't remember having interacted with students of other courses or programs, but now the students that we train as part of especially the One Health initiative of working in, not only from the human health perspective, but also animal health and the environment, you find that in our training, we try to inculcate the culture among the students that we can't solve health issues by health alone and need to work with other disciplines to solve health issues, but also other issues affecting society. So in that way, we are trying to bring up these students to become professionals who appreciate that they can't work on their own, but need to work across the board and work with other disciplines as part of their practice. Thank you very much.
Thank you very much. And then I will throw the question to Jovia, but add an extra level of well, difficulty, maybe you could say, which is we've talked about how to work across silos or to work with other researchers. We've talked about how to include women and ethnicities, et cetera, but how then do we also make sure that we work with the communities? Because that's another layer to it. Like we've talked about in terms of breaking the silos across, but maybe not so much in terms of like diagonal, what's the word, vertical. I don't like to use that word, but the reality is, how do we ensure that it's diversity also in the sense of turning the tables and getting to work with the communities and changing our own biases and you know, the ways we think a researcher, a scientist is like this. Communities do not necessarily fall into that kind of image, so we don't work with them. How do we overcome those biases? Jovia, sorry.
Thank you, Clara. I think one way to work with communities is to engage them. I will say in setting research agendas, or even on these, what should I call it? Let me call it a panel of researchers. Like they said, involve the females, involve the males, involve someone from the community, or involve people from the community that are actually aware of the problems that are affecting the community. Involve women, involve men from the community, such that when you come up with a research topic, it is something that is going to impact the community positively, that is going to actually solve their problems, and not something that we think is going to help them. And I think in such a way, the community will feel involved and will also own up to the research and be involved in coming up with sustainable solutions that will help them improve their health. Yeah.
Thank you for succinct but very, very relevant answer. So building on what you said and referring to something David said earlier about, you know, not doing research for research's sake. There was a question that talked about a lot of funding comes from the global north. And in that case, I guess sometimes that would lead to doing research for research's sake and not really listening to the community, referring to what you just said now, Jovia. So given the lack of resources and the fact that resources are limited in every context, but particularly so in African context, and then there's available funding from the northern kind of partners, how can you balance having access to this funding and resources while making sure that we're not completely driven by the agenda that goes with that funding, that we're not doing research for research's sake and we're not listening to the communities? How do we balance the two things? Because there can be a tension there sometimes. This time I'll start with Jovia again. I know you finished last time, but over to you.
You said, how do we balance them having the funds and putting our priorities to be funded? I think this is partly where our leaders come in. I think it is important that they set the priorities straight for, let me take an example, Uganda. If it is malaria that is really affecting Uganda, or malaria and sleeping sickness and any other disease, I think it is important that they make it clear to the funders that this is where their interest is, and that this is where they need the funding, such that if maybe a funder out there is not interested in that area, they can look probably to another developing country that has this problem as high priority. Yes, that is what I think for now.
Thank you. Over to you, Abel, please.
Yeah, thank you so much, Clara. You raised a very important question here. Actually, we keep asking ourselves the same question every day. And do you know what we envision 5-10 years from now? Is to greatly increase funding availability for Ugandan scientists or East African countries to deliberately increase funding for national level research. As long as we will keep waiting to get funding from MIT, from Bill and Melinda Gates Foundation, from Wellcome Trust, we will keep dancing to their tunes. We will keep following their agenda. We will keep aligning our proposals in their core, in their interests. So as a country, there is need for deliberate effort in increasing research funding. That is number one. So what we are doing is to set up a research fund. That one we are doing it, and I want to just share with you a story that in the 1 year we have existed, we have been able to do 2 projects that have reached commercialization. One project has developed PCR diagnostic kits, and we think that if that projects begin large-scale production of PCR testing kits, and we are exporting them to various parts of the world, I am telling you the benefits or the profits, even if we only take 10% of that and we have in the research fund, that money will be able to fund other innovators who are coming from down. So we think once we increase funding, we will address that issue. The second issue we are trying to do, as we get collaborators who are coming in the country right now, our first question is, how do we ensure technology transfer? If we have a collaborator coming from Russia, we are not interested in them producing whatever they are producing from there and they bring it to sell here. What we are requesting them is that you come here and work with our scientists here, and we transfer the knowledge, the technology, we import the equipment that we need to produce this or to develop this here from our country. We think in so doing, we will build the financial muscle of the country for our science and research in the country.
Thank you very much. And now I will turn to David, but referring to some of the things that the other colleagues have said. So Jovia talked about, you know, maybe signposting the funders and saying, well, we don't need malaria research in this country, you can go to the next country. And Abel talked about the work that the government is doing and the demands or requirements of the government. But let's be practical here. If you're a junior researcher, you're trying to advance your own career, how easy is it really to turn to a funder and to say, no, you're offering me 2 million, of course, to do research, but that also means I will be PI on this research. Which would advance my career vastly, but no, I don't want the money, you can go to the country next door. That's the first thing. The second thing is the power dynamics, because when we talk about decolonization, etc., it comes back to power. How do you look a funder, a big organization, the Gates Foundation, and then say, no, I don't want the funding? How do we deal with this in reality? Is there even a way of dealing with it? I know this is a hard question, but you got the final question, so you can try to answer it.
Thank you very much, Clara. And I know Abel and Preside and other government bodies envisage a Uganda so many years down the road where our research is 90% funded by the government, and that would really be great. But to be very honest with you, realistically, that may take some time to come. And for that reason, like you rightly said, Clara, I think the Global North funding sources are here with us to stay for some time, not only for the junior researchers, but even the senior investigators. I don't think that is going to change. I'm really pleased that the government of Uganda and other governments in Africa over the years are increasing the research funding, which is great. But I still think we need the Global North funding partners, because that is where I think most of the money is, at least for now. and we need to tap into those resources. So for that reason, I don't think I would advise any junior researcher or any researcher for that matter to turn away funding from a global North partner just because they have brought the agenda. But I think we need, as researchers and as stakeholders, to make some steps moving forward to see that even with funding from abroad, the funding is well advertised, is really addressing our interests, and that it is really addressing our needs. And I don't think that can be done in 1 year, but I think we can make some initial contributions as we go along to try and make the global North funding agencies and partners appreciate our concerns and indeed try and do things not just in their interest, but having our local interests in place. And a few suggestions could be, as I talked earlier, I think it's important that when these global North partners or funding agencies are setting the research agenda, we need to, in one way or another, have inroads in being part of those processes and discussion. Again, it's not something easy to do, but I think if we can have such platforms where we, air out our views, invite such global North partners to take part and hear our conversations and concerns. If we are in meetings with them and engagements in various fora, we need to make this well known. Some of us who have projects interact very closely with some of the funders, their project officers and their grants managers. I think we need to bring these issues on the table, but also give suggestions, such as, for example, for a new funding scheme, if you can consult the Ministry of Concern in the countries of interest, if you can conduct a scoping review to try and appreciate the issues on the ground, that could help change the mentality and have them appreciate the importance of consulting and involving the beneficiaries as opposed to them sitting wherever they are and deciding the agenda for us. But also to note that as local researchers taking part in global conversations, whether it's webinars or seminars or conferences or discussions, and making our voices be heard, but also make a strong case concerning what has to be done. That I think is critical. This whole debate on decolonizing global health, as I said, has predominantly been driven by selected global North researchers and partners. So I think we need to have our voices heard a bit more from the global South, publishing more commentaries, taking part in engagements, and let these issues be heard so that those in power from the other side can appreciate, and hopefully things can change slowly as you go along. It's really a tough ask, but I think if we do small steps at the time, we may get there at some point. Thanks.
Thank you very much for trying to at least answer the question, and also for proposing very practical ways and strategies for dealing with it. I think we have time for the very last question, so if you can just keep it very brief. But this was about capacity building, which is often talked about as lack of capacity for health research, etc., etc. And someone said a lot of the capacity strengthening or capacity building is very limited to individuals. So skills, training, conferences, etc. But it does not include the broader research environment. So how do you think we could work on this in the African setting to build capacity, not just of individuals and not just in the short term, but in a long-term kind of way, so that while we're working, as Abela said, on increasing the funding and making all the funding 80%, 90, 100, hopefully one day, of the funding come from Africa, we're also working on putting the infrastructure, the capacity, everything in place. When I say infrastructure, I'm talking about human resources here and everything else that's needed to make sure that we can also then use those that funding to indeed do African research for Africa in the short, medium, and long term. What are some of your suggestions? I will start with David.
Thank you, Clara. That's a very important question, actually, because many times capacity building is looked at individual level, yet I think in terms of benefiting the country, having institutions strengthened and built is the way to go. I'll give a few examples of how that can be done and what we've actually done at Makerere University at the School of Public Health to really build institutional capacity in addition to individual capacity. So some of the grants that we have applied for and been awarded have been written and achieved in terms of building institutional capacity. And this includes grants that support equipment, technologies, and other resources that benefit the wider university environment, including students and faculty, as opposed to opportunities that only benefit individuals for, say, master's or PhD studies. So some of those grants have really been built to benefit the broader university environment as opposed to individuals, but also having such grants build capacity of several people as opposed to just one. So this could include short courses and webinars and other initiatives that benefit a wide range of individuals. And these individuals from the Makerere experience include students. We have very clear initiatives and grants that support students, but also those that support early career researchers and faculty. We have those projects that are supporting administrators and support staff, but even those that support senior investigators who require support in their work. But also at Makerere, we have put in place some initiatives that are supporting early career researchers in totality as opposed to an individual. And as an example, we have a recently started series to build capacity for early career researchers, whereby we invite different speakers to talk about various research topics that are of interest to build their capacity as a group that we are interested in. And I chair a committee at the School of Public Health, which is specifically handling this. And the topics we're looking at include, grants writing, publication and scientific writing, how to, win grants, how to work with mentors, and other research skills, and also leadership skills, which we believe are important for the various individuals involved to become better researchers and be able to influence policy and practice in their future engagements.
Thank you very much, David. I will go to Jovia, please.
I think another way to improve capacity building would be to engage the communities again. I think it is important to provide the communities with the information that they need to know, for example, during research, what should be done, how should we be treated, how should we make sure that the data that has been collected from us is going to be used to help us, how can we be involved in, setting the research agenda. I think it is important to build capacity of community, first of all, by making them aware, and also by engaging them in the research process. Yeah, that's what I have.
Thank you. That was a very good perspective. It's something that we often forget when we talk about capacity building is the community. So now we've heard from the researcher side, we've heard from the community side. Over to you, Abel, from the other perspective. Yeah.
Thank you so much, Clara, and you raise a very important point here. I just want to supplement on what Dr. David said, the capacity building programs. Now, as he has hinted about for the one for early career researchers, we have also deliberately set up, and I'm now talking as part of School of Public Health, where I am attached as well. We have deliberately designed a program for empowering and mentoring the current students. And we think that through this mentorship, the students get to appreciate the relevance of research, and we shall build their capacity. Now, in the same line, I want to tell you, Clara, that the mindset of students, university students, is that they want to finish the course and go away. They want to finish the course and go away. They want to finish the course and go and look for the job outside there, forgetting that these professors, they are living in the building, have a number of projects, have a lot of work that they need help actually. Just for information, Kirara, these professors did help. They need support from the early career researchers, from fresh students. Now, the mindset of students is that I must finish and go away. Actually, when you meet the third year or the fourth year students, their conversation is how to go away. So that is something that I thought I should bring here. Now, from the level of the Ministry of Science, Technology and Innovation, we are designing a fellowship program. We have realized that there is a gap in knowledge, there is a gap in skills. And so there is a fellowship program we are designing deliberately to attach young or fresh graduates onto the already established researchers or professors or lecturers. It's a deliberate move. We think that once, and we shall be attaching them for 1 year, we attach them to these scientists and then they learn from them. And we think through learning, they can be absorbed. They can also learn how to write projects and they can work with that professor moving forward. Now, among the projects we are funding, last year we funded 23 projects worth 25 billion Ugandan shillings. We deliberately told the principal investigators to include in PhD students, master's students, and some undergraduates. And we told them that among the project staff, please have a career team and let them work with you, let them learn how you do it, let them grow your capacity. So that is the move. Actually, we are deliberately working on that. We want to see that we attach, we empower, we nurture. We attach, we empower, we nurture. Now, lastly, we have a government institution called Uganda Industrial Research Institute, called URI. Now, we've just been discussing with them this morning. It is a government entity. They have space for any person, be it a scientist, be it a non-scientist, as long as you have an innovation. So if you have an innovation, you just walk to URI. They have space for you to incubate your idea, and they house you for how many years? For 3 years, for free. So you're not paying rent. So you have a desk, you have space, you keep working on your idea, you come and sit there, innovate, write. There's internet, you write, you consult with people experts who are in that area. They help you to better your idea. We think after 3 years, if it hasn't taken off, then it may not be a viable idea. So we let you go. But we think this government institution called URI is doing a lot of work and creating room for younger scientists to incubate their ideas, but also to grow their idea forward. Yeah.
Thank you very much. We've run out of time, but this has been a very, very, very interesting discussion. Personally, for me, to keep hearing the very concrete examples that Jovia and David and Abel have cited over and over again, it's been very, very invigorating, honestly, to hear these examples. So I would like to thank first and foremost the presenters, the panelists for making your presentations, and then for dedicating half an hour to answering our questions, to engaging with us. Thank you very much. In person, we would give you a round of applause, but we're on Zoom, so yeah, we're doing it, but you can't hear us. And I would like to thank the organizers. I would like to thank Frank and Danny for all the hard work they've done with sending emails, and Ravi, Thomas, all the other colleagues, for all their hard work putting all of this together. And of course, last but not least, I would like to thank all the participants today, all the people that suggested questions, all the people that stayed and listened and made this discussion as interesting as it has been. And so with that, I wish you all a good afternoon, a good rest of the week, and I look very much forward to seeing you in future webinars around this subject. Thank you.
Thank you so much, Clara, for your wonderful facilitation. It's been amazing and amazing and amazing. With a very short, brief minute, I want to invite Ravi to make a few announcements before we all jump out. And his conversation will also touch on what next after this series of webinars. Where are we going? Where we seeing ourselves forward? Ravi, please, if you're still there, come and take the time. Thank you.
Thanks very much, Danny. And thanks, Clara, and all the presenters. I think it's been a very stimulating dialogue. Really want to appreciate all the rich discussions on the chat box as well. I think it's been fantastic. For us in the Kampala Initiative, we're working with Innovations for Development and People's Health Movement, the Uganda Country Circle, to bring these webinars forward. We are now just completed the third webinar in the Decolonizing Health series. And what we expect to do is to have the fourth webinar. Stay tuned via the website that's in the chat, and you'll get the announcement about the next date. This will be about decolonizing health in Africa, looking at health laws as a focus. Laws and regulations that govern the health sector here among our countries in Africa. So we'd also like to just give a shout out to the team that launched an Africa Decolonizing Health series last year in September. These form an Africa-led dialogue about decolonizing health. And I very much encourage you to click on that link for the Kampala Initiative. It's hosted at the Medicus Mundi website. And from there, if you've not already done so, you can read about the webinars that have taken place and future ones that are planned. You can find the Kampala Declaration, and if its values align with your thinking, feel free to endorse it. And that will give you the chance to enroll in the Beyond Aid email list. And at that point, you'll be able to get further announcements. So with that, I'd like to thank everybody for participating today and hand back to you, Danny.
Thank you so much, Ravi, and thank you everyone for listening in. Just one quick announcement. The Kampala Initiative under the TCI, Track Change Initiative, is also organizing sort of like a focus group discussion to collect information from participants across Africa and the world in regards to framing the language. So an email will be dropped to have people fill out a survey. Please don't hesitate to give us your feedback in regards to framing the language. We've been talking about decolonizing the language, especially within the space of aid, the aid narrative. So we want to pick ideas and perspectives of what it means to decolonize the language, but more so framing new narratives that we think are, pertinent to people's understanding and appreciation of the future that we desire. So an email will be shared. Having said that, I want to thank each and every one of you. A report is going to be written and the recording will be available. So feel free to listen in, watch wherever you'll be. It will be shared in the coming days. Once again, thank you so much, and we're glad to have you, and we look forward to seeing you again. Thank you, and God bless you. The struggle continues. Bye-bye.
Thank you. Bye.
Bye.